The MicroClave Clear Neutral Displacement Needle-Free Connector from ICU Medical is specifically designed to help you reduce the risk of bacterial contamination and improve patient outcomes. The MicroClave Clear incorporates the same clinically proven internal fluid path design and construction as the original MicroClave neutral displacement connector and has a clear housing allowing for visualization of the internal fluid path. The MicroClave Clear features a clinically preferred split septum design and is comprised of 3 separate components: an internal blunt cannula that provides a dedicated internal fluid path, a flat, swabbable split septum compression seal that covers and seals the fluid path, and a clear polycarbonate housing that allows for visualization of the internal fluid path. To access the MicroClave Clear, first swab the flat silicone surface with an approved disinfectant according to your facility protocol. When the MicroClave is properly disinfected using a clinically validated swabbing technique, microorganisms are removed from the access site of the split septum. As the access lure contacts the sterile silicone surface and begins to compress the septum, a dynamic seal is created and the internal blunt cannula begins to pass through the split septum. The internal fluid path is accessed only when the silicone is compressed and the windows of the cannula become exposed inside the internal diameter of the access lure. This creates a dedicated internal fluid path where at no point does the exterior of the access lure, split septum, or housing come into contact with the fluid path. When the access lure is removed, the septum returns to cover the cannula and closes the fluid path once again. Because the MicroClave Clear allows you to visualize the internal fluid path, you can easily verify that you have effectively flushed the connector after use with blood or medications. And the design of the MicroClave Clear provides the same neutral displacement performance as the original MicroClave, which is possible due in part to the exceptionally small dead space of 0.04 milliliters. Neutral displacement means that there is minimal blood reflux in the catheter tip upon connection or disconnection of a lure. This feature allows you to use the MicroClave Clear with any clamping protocol, which eliminates the risk of technique error that can occur when using either negative or positive displacement connectors. The MicroClave Clear also allows you to use a saline flush protocol, which can provide you with a cost savings while eliminating the risk of any clinical complications associated with heparin. And the MicroClave Clear can be used on all peripheral, arterial, and central venous IV catheters to administer IV fluids, medication, and blood products. The proven performance, innovative neutral displacement design, and clear housing of the MicroClave Clear from ICU Medical makes this the clear choice for your needle-free connector needs. Integrating MicroClave Clear into your clinical practice can help your overall efforts to enhance patient care by helping you visualize connector flushing and reducing the risk of bloodstream infections.